Drug Dosage Forms Part 1. I am Professor M.U.R. Naidu. What is drug? Any substance used for prevention, diagnosis, treatment, prognosis of a disease, and a palliative care, or for a prevention of pregnancy is known as drug. Drugs are not administered as a pure chemical substances alone. It is formulated by adding various excipient. Dosage forms: a physical form in which a drug is produced for administration to the recipient is known as dosage form. Pharmaceutical preparations provide safe and accurate dosage of drugs for the treatment of various diseases. What is the objective of designing a dosage form? The principal objective of a dosage form design is to achieve a predictable therapeutic response to a drug used in that particular formulation, which is capable of large-scale manufacture with reproducible product quality. What is dose? The amount of medicament to be administered to the patient as directed by the physician is known as dose. It is expressed either as weight or volume or unit. What you mean by response? The change in activity of cell or a tissue produced by drug is known as response. Dose response are always closely related. They are termed as dose-response relationship. There are various factors which modify the dose, ultimately modifying the response. If the dosage are modified, definitely it also modified the response of a drug. Why suitable dosage form are needed? For the protection of a drug from destruction influenced by atmospheric oxygen or moisture, we use a coated tablet or sealed envelope. For protection of drug from destruction by the gastric acid on oral administration. The most time we mask the bitter taste or foul odor of a particular drug by making as a capsule or flavored syrup. To provide a liquid preparation of substances which are insoluble or unstable in desired vehicle suspension. So these are some of the reasons why suitable dosage forms are needed. Suitable dosage forms are needed to provide: number one, extended release action through controlled release mechanism. Optimal drug action on topical application. Formulation of drug administration by insertion into the body orifice. Example is suppositories. Placement of drug within body tissue is used like by using injections. Liquid dosage forms of soluble substance is desired in a particular vehicle in the form of a solution. The drug action through inhalation or aerosol is also used in some of the disease conditions. Formulation includes drug plus excipient. Why are excipients used? To thicken, preserve, emulsify, modify the dissolution, improve the compressibility, add favor, and modify the dimension. These are the reason why actually we use excipient with every drug. Dosage form comprise of active ingredient, excipient, like vehicle, it may be water, elixir, syrup, etc. Coloring agent, tartrazine, emulsor solution, caramel, colors should not be too bold to hamper the diagnosis. Sweetening agents like sucrose, saccharin, sorbitol, mannitol, aspartame are sometimes used. Flavoring agents like coca, raspberry, orange is used. Other lubricant binders, diluent coating solutions are also used. Different type solid dosage forms like powder, tablets, capsule, suppositories, and pessaries. Semi-solid dosage forms like ointment, cream, paste, gel, and jellies. Liquid dosage form includes solutions like oral solution, syrup, elixir, parenterals, suspensions, emulsions. These are all actually the liquid dosage form which are available for administration. Route of drug administration. Different ways the administration of drug at the site in a patient from where the drug is absorbed and it is delivered to the target tissue for the desired action. So route of administration is very, very important. Various route of administration which is used for the treatment of disease includes local route, systemic route. Local route include topical application on the skin or mucous membrane, deeper tissues, arterial supply is important. If good arterial supply is there, drug will be well absorbed from the mucous membrane. Systemic administration, oral, sublingual or buccal, rectal administration, cutaneous, inhalation, nasal administration, and parenteral administration. Now coming to the parenteral administration, it may be subcutaneous, it can be intramuscular, intravenous, or intradermal. Inhalation is by aerosol. Oral route, different routes of administration. Oral route is there, most commonly used. Simplest to use. Self-administration is possible. Safest if used properly. Different routes of administration. Oral. The limitation is onset of action is slow. Absorption for GIT may be irregular. Some drugs are destroyed in the enzyme in GIT. It is not effective. First pass effect, pre-systemic metabolism can occur in some drug. Drug soluble altered by presence of other substance in gastrointestinal tract. Gastric emptying is very important and variable. If there is a lot of variation in the gastric emptying time, absorption of drug may vary. Unsuitable for unconscious patient who are having vomiting or pre or post operative care. Different routes of administration, buccal route, vascular nature of tongue and buccal milk cavity, presence of saliva, sublingual absorption or buccal absorption, formulated as tablet or spray, features fast onset of action, short duration, directly gain entry into the systemic circulation from the buccal mucosa. First pass effect has to be avoided. Example is nitrate. Can be administered to unconscious patient. Buccal mucosa is the area between the upper lip and the gums. Different route of administration, rectal coming, where the liquid, solid or semi-solids are used. Drug may have local or systemic effect. Depending on the position of the drug in rectum, some drugs will be locally absorbed, some may enter into systemic circulation. Bioavailability may not be 100% but better than GIT part. Mucus presence is about 3 ml limits the dissolution of drug in suppository. Rectal route advantage when oral route is unsuitable, rectal is useful. For example, vomiting, unconscious, uncooperative patient. When drug causes GIT irritation, can be used for local action. Disadvantages less acceptable and irregular absorption. Coming to vaginal route, here we use pessaries, some tablet, capsule, cream, foam, ointment or solution. Advantage can be used for local action. Disadvantage availability is hampered. Coming to inhalation route, drug administered through nose or mouth produce local or systemic effect. Main application is to treat respiratory conditions like asthma. Advantage is drug is directly delivered to the site of action, that is into the lungs. Drug requires considered low dose. Side effects are minimized. Nasal route, drug administered through nose using drops or spray. They can produce systemic effect because it is good vascular capacity which avoid first pass effect metabolism. Different routes of administration: the topical route, local administration to skin, powder form, ointment, cream, or paste. Skin is natural barrier. Specialized dosage forms are required. Produce systemic effect, avoid first pass metabolism. Can produce close to zero order kinetic over prolonged interval. Coming to parenteral route, intravenous, given into the vein, directly administered into circulation. Intramuscular, in muscle layer or subcutaneous, in the cutaneous layer of skin. Least painful self-administration is also possible, like insulin. Thanks. We will continue with the part 2 subsequently.